Hello and welcome. We've all seen the dramatic movie scene. A man suddenly clutches his chest, gasping for air. We've been taught to look for chest pain, shortness of breath, and pain radiating down the left arm. But what if I told you that for millions of people, especially women over 50, your body's most urgent warning sign of a potential heart attack isn't in your chest at all? What if it's whispering or even shouting from your legs? Ignoring this one subtle symptom is a mistake millions are making, and it could be fatal. Heart disease remains the #1 killer of women, yet it is a disease shrouded in misconceptions. The primary misconception is the very image we just described, the Hollywood heart attack. While that can and does happen, the reality, particularly for women, is often far more subtle and deceptive. The symptoms can be confusing, vague, and easily dismissed as something else entirely. Indigestion, anxiety, or just the aches and pains of aging. This is why women often delay seeking care and why their outcomes can be worse than men's. Today, we are going on a journey deep inside your circulatory system, a vast network of highways that spans over 60,000 miles. We are going to expose how a traffic jam in one remote part of this highway system, your legs, can be the most reliable indicator of an impending catastrophe in the capital city, your heart. The symptom we are about to discuss is a classic sign of a condition called peripheral artery disease, or PAD. And what cardiologists know, and what you need to know, is that PAD is not just a leg problem, it is a total body problem. The presence of PAD is one of the strongest predictors we have for a future heart attack or stroke. Understanding this connection isn't about creating fear. It's about giving you a crucial piece of life-saving detective work you can perform on your own body. So, what is this one critical symptom in your legs? It has a medical name, intermittent claudication, but let's break that down into plain language. It is a cramping pain or a tired, heavy feeling in the muscles of your legs, most often your calves, but it can also be in your thighs or buttocks. But here is the absolute key, the defining characteristic that separates it from a simple muscle cramp. It occurs with activity, and it is relieved by rest. Imagine this scenario. You're walking through the grocery store. After a few aisles, you start to feel a deep, aching cramp in your calf muscle. It gets progressively worse until it's so uncomfortable you have to stop and rest for a minute. You stand still, and within a minute or two, the pain completely disappears. You feel fine again. So you start walking, and a few aisles later, the exact same pain returns in the exact same spot. That is the classic textbook definition of claudication. Why does this happen? It's a simple and terrifying matter of supply and demand. Your leg muscles, when you are walking, demand more oxygen-rich blood. But if the arteries that supply your legs are narrowed or partially blocked by plaque, a condition called atherosclerosis, they cannot deliver enough blood to meet that demand. The cramping pain is your muscle's way of screaming for oxygen. When you stop walking, the muscle's demand for oxygen decreases, the limited blood supply is once again sufficient, and the pain goes away. It is a direct, real-time signal that there is a traffic jam in the arteries of your legs. Now for the most important part of our discussion. Why is a cramp in your calf a warning sign for a heart attack? Because the disease that causes the blockage in your leg arteries is the exact same disease that causes blockages in your heart arteries, atherosclerosis. Atherosclerosis is a systemic disease. It doesn't just happen in one part of your body. If you have plaque building up in the arteries of your legs, it is almost a statistical certainty that you also have plaque building up in the arteries leading to your heart, the coronary arteries, and the arteries leading to your brain, the carotid arteries. Your body is one interconnected system. A traffic jam on the highway to your legs means there are almost certainly traffic jams forming on the highways to your heart and brain. This is why doctors consider a diagnosis of PAD to be a coronary artery disease equivalent. It means your risk of having a heart attack or stroke is just as high as someone who has already been diagnosed with heart disease. The pain in your leg is your body's early warning system. It's a gift. It's a chance to take action before the blockage in a more critical artery, like one in your heart, ruptures and causes a catastrophic event. So many people ignore this sign. They blame it on arthritis, sciatica, or just getting old. They don't realize their legs are trying to save their life. The claudication in your legs is a major specific clue, but it's also important to be aware of other atypical heart attack symptoms that are more common in women. While the leg pain is a sign of underlying disease, these next symptoms can be signs of a heart attack happening right now. 1. Profound, unexplained fatigue. This isn't just feeling tired. This is a sudden, overwhelming exhaustion that makes even simple tasks like walking to the bathroom feel like climbing a mountain. It can last for days leading up to a heart attack. 2. Shortness of breath. This can occur with or without chest discomfort. You might feel like you just run a marathon even when you're just sitting still. 3. Pain in the back, neck, jaw, or stomach. Instead of the classic chest pain, women may feel pressure or aching in their upper back, neck, or jaw. They might also experience severe stomach pain that is often mistaken for heartburn, the flu, or an ulcer. 4. Nausea and dizziness. Feeling nauseous, lightheaded, or breaking out in a cold sweat are also common signs in women. The pattern is clear. The symptoms are often vague, confusing, and located outside of the chest, but they are very real. The key is to listen to your body. If you experience any of these symptoms, especially if they are new, sudden, and don't feel right, it's time to seek immediate medical help. Knowledge is power, but action is what saves lives. If you recognize the leg pain of claudication or any of the other symptoms we've discussed, the first step is to see your doctor. But what can you start doing today to protect your arteries? The prevention plan is based on 3 pillars. Pillar 1, the anti-inflammatory diet. Atherosclerosis is an inflammatory disease. You can fight it with food. This means a diet rich in fruits, vegetables, lean proteins, and healthy fats, like the Mediterranean diet. Focus on foods that actively clean your arteries, like fatty fish, salmon, nuts, walnuts, olive oil, and leafy greens. At the same time, you must eliminate the foods that promote inflammation, primarily processed foods, sugar, and unhealthy fats. Pillar 2, the right kind of movement. The best exercise for PAD is walking. A structured walking program where you walk until the pain starts, rest, and then walk again can actually help your body grow new, small blood vessels that bypass the blockages, a process called angiogenesis. Regular moderate exercise is also crucial for controlling blood pressure, managing weight, and reducing stress. Pillar 3, know your numbers. You must be a proactive partner with your doctor. This means knowing your blood pressure, your cholesterol levels, especially your LDL and HDL, and your blood sugar levels, HbA1c. These numbers are the dashboard of your cardiovascular health. Knowing them and working to keep them in a healthy range is the most powerful thing you can do to prevent a future event. Your health is your most precious asset. Taking these proactive steps can add vibrant, healthy years to your life. If you found this guide valuable and want to learn more life-saving, science-backed strategies for thriving after 50, please subscribe to Dr. Maskola. Share this video with the women you love. It could be the most important conversation you ever start.